primitive reflex, milestones, and the beginning of postural development, like the visual proprioceptive writing reflex and all that, starts in the brainstem. Gross motor motion is in the brainstem. The primal reflexes are located there, and the milestones are pre-programmed in what we call a pre-programmed proprioceptive feedback loop in the base of the brainstem. So they're supposed to trigger all at the same time because they are defensive mechanisms or survival mechanisms for the infant. As the infant grows and starts to function differently and use different parts of the brain, as they start to get up to around age 2, when the primal reflexes dissipate and when most of the major milestones are beginning to kind of be formed, then at that point the prefrontal cortex kicks in. So what often happens if there is a dysfunction in the relationship between the brainstem, midbrain, and the prefrontal cortex, some kind of interruption, whether it be a dermalingeal subluxation, a cranial subluxation, some kind of aberrant input, it affects that pathway from the brainstem to the midbrain to the prefrontal cortex, and therefore the primal reflexes maintain themselves because the patient stays in, or the child stays in, a fight or flight state. At the same time, because of the postural considerations with the base of the brainstem, and as the child goes through those milestones, as they change the postural parameters, that increases neurological input and it causes more of the brain to be used into play. And if there is an issue with that, an inability for the brain to function normally, and the thresholds are reached, then the child has to compensate for that, and often retain primal reflexes occur, or the milestones be delayed, or they'll have postural coordination issues because that pathway is being disrupted from either subluxations in the spine or in the cranium or aberrant neurological input.